Introducing the ErgoNurse, a revolutionary system designed to solve a severe, ongoing problem in the healthcare industry: the high rate of musculoskeletal injury experienced by patient caregivers. Medical professionals, such as administrators, nurses, and nurses' aides, are well aware of this problem, its expenses, and its consequences. The healthcare industry spends nearly $2 billion a year for workers' compensation claims due to back injuries. This amount does not include sick days or the personnel replacement and retraining costs created when nurses can no longer work in the profession because of back injury. Nurses and nurses' aides are personally and painfully aware of the problem. Over half the registered nurses report chronic back pain. When compared with construction and dock workers, nurses have a 6 times greater rate of back injury. Not all pain and disability can be linked to a specific injury because back injury is incremental. The cumulative effect is caused by the bending and lifting required for patient care. It is impossible to use good body mechanics for moving or repositioning patients in their beds. The increasing obesity rate of the American people will only exacerbate the problem. Any system which seeks to relieve nursing back pain and the accompanying injuries must be able to turn patients from side to side, pull patients toward the head of the bed, center patients in the bed, assist with linen changes, place patients on bedpans, accommodate patients on spinal precautions, transfer patients from bed to wheelchair, transfer patients from bed to bed. Existing equipment, such as the Hoyer lift, can transfer patients from bed to wheelchair. However, equipment to transfer patients from bed to bed is not widely used or readily available. The ErgoNurse is designed to perform the first 6 functions. The ErgoNurse lift is placed for use at the head of the hospital bed, where it occupies less than 5 inches of floor space. The ErgoNurse will remain at the head of the bed for as long as the patient needs assistance with repositioning. The bend in the central column accommodates most overhead bed lights. Because the ErgoNurse is mobile, it can be moved to another bed or room when needed. Hospitals, nursing homes, or rehab centers need not purchase a unit for every adult bed. The ErgoNurse uses a very simple yet elegant design which does not require motors. This innovative design provides several advantages. Bed motors are used to actually move the patient. These motors are slow, smooth, and safe, all of which increase patient comfort and confidence. Easy, intuitive use, which lowers training costs. Minimal required maintenance. Lower purchase cost, allowing strained budgets to provide nurses with patient equipment that actually works. The ErgoNurse provides another cost savings. Special linen or harnesses are not required. Patients are moved using the existing hospital linen as a draw sheet. The fabric clamp may be attached to any part of the draw sheet to provide the leverage and support needed to move the patient. Because the ErgoNurse is designed to be portable, it is not fastened to the bed. The arms also fold neatly out of the way when not in use, minimizing interference with other patient care. In the case of a code or need for resuscitation, the bed is simply moved away from the lift, allowing full access for intubation and other procedures. To turn a patient onto his or her side, raise the bed. Pull down the web belt on the ErgoNurse and buckle it to the fabric clamp. Remove the slack from the belt. Lower the bed. The patient rolls easily and comfortably on his side. Use pillows to prop the patient in position. Raise the bed to provide enough slack to release the belts. Patient size or weight is immaterial to the function of the ErgoNurse. It works for normal and heavyweight patients. However, heavier patients no longer need to be jerked and tugged when they are turned and repositioned. For comfort or ease of breathing, most hospital patients have the head of the bed raised. Unfortunately, the weaker or more impaired a patient, the greater the effect of gravity. Patients always slide to the foot of the bed. Considerable force, especially for heavier patients, is required to lift and move the patient back into a more comfortable position. The ErgoNurse allows one staff member to easily perform a procedure which almost always requires two people. Raise the bed. Pull down the web and latch it to the grippers. Reduce the slack in the webbing. Lower the bed. The patient gently moves to the correct position. When the patient is in the correct position, the nurse simply stops moving the bed. The same technique is used to center the patient on the bed. The fabric clamps are placed approximately equal distances from the patient on either side. When the bed is lowered, the patient naturally moves to the center of the bed. Until now, no mechanical aid has been able to replace the bending and lifting performed by nursing personnel when changing bed linens. The ErgoNurse can easily perform all of the lifting needed for this essential function. Two methods can be used to change linen. First method. Raise the bed. The fabric clamp is attached to a draw sheet beneath the other linen. Lower the bed to turn the patient on his side. A second nurse may be needed to stabilize the patient on his side. Release the webbing and remove the clamp from that side of the bed. Roll the soiled linen next to the patient and spread clean linen next to him. Allow him to roll on his back on the lumps of linen. Using the bottom draw sheet, turn the patient onto the clean linen. Remove the clamp and then remove the soiled linen. Spread the clean linen over the other side of the bed. Place pillows if necessary to prop the patient on his side. Second method. If the linen is not heavily soiled, the patient may be suspended over the mattress. Attach the clamps on each side of the patient, take up the slack, and lower the bed. The linen beneath can be changed quickly since very little weight now rests on the mattress. After clean linen has been placed, the patient can be rolled from side to side to replace the draw sheet. The ErgoNurse lift is designed to suspend patients so they can be placed on a sling or pressure reduction mattress. The ErgoNurse transforms the way patients are transferred and repositioned. Hospitals could truly implement no manual lift policies, significantly reducing costs. ErgoNurse, the new standard of patient care, will eliminate nurses' debilitating on-the-job back injuries.